Hello, everyone, and welcome to our webinar. The fact that we have hundreds of webinar attendees shows just how important the topic is for the education community. Thank you all for joining. My name is Roei Friedberg, and I'm the CEO of Aura Americas. Aura was founded 4 years ago with the vision of providing a safe and healthy indoor environment, but also educating people on what we're breathing. We partner with schools and districts around the world to improve the air quality in their classrooms, facilities, and school buses. Our technology is being used in thousands of classrooms across the US and globe. We are honored to be the partner of choice of some of the latest districts in the US, including my fellow panelists, Leslie, Deborah, and Joe. Here's what we're going to cover today on our webinar. Although plenty has changed since the early days of the pandemic back in 2020, today we will focus on the changes related to schools' environment and learning. We will discuss what changed and why. We will then dive right into a survey results of recent National Educator Survey to learn about what is on top of mind of our educators today. Our dear panelists will address the impact of current state of learning environments on students and school personnel. We also have an interesting case study from Jackson Public Schools in Mississippi that will be shared before we wrap up with an open Q&A session. Before we get started, I'm honored to present to you all our panelists for today's webinar. True subject matter experts. I will let our panelists introduce themselves. Leslie, why won't you start?
Good day, everyone. I'm Leslie Boggs. I am the immediate past president for National PTA. For those of you that are not familiar with PTA, we advocate across the nation for our children and families, their health and welfare, in order for every child to reach their best potential. I've been very honored to be president for a national association as well as Texas and New Mexico. So I have a great background with all of you as far as being parents and family members. I also recently am the president of CarrellBoggs Consulting. We specialize in leadership and DISC personality assessment as tools to make you a better person and a better leader within your community.
Thank you, Leslie. Deborah, you want to go next?
Absolutely. Good day to everyone. My name is Deborah Harrington. I am the founder and CEO of Energy Audits and Green Solutions. As a certified minority company, we have been blessed to be able to go into schools, government institutions, and buildings alike to provide energy analysis to help with some sustainability, allow facilities to become LEED certified, and specifically with our schools, being able to go in, share with them some of the issues as they faced in terms of trying to keep their environments clean and safe, which is certainly our topic for today. And we've focused over the last 2 years since 2020 with the pandemic to provide PPE to schools and other institutions around the country and actually globally. So I am pleased to be here with my other subject matter experts and look forward to sharing a lot of information to you.
Thank you, Deborah. Joe?
Well, good day, everyone. My name is Joe Albright. I'm the managing consultant for Performance-Based Solutions, which is an engineering, education, business management, and leadership consulting firm. Prior to that, I was the chief operating officer for Jackson Public Schools in Jackson, Mississippi. And then prior to that, I was also the vice president for Sodexo North America Schools and Universities Education Market. It is certainly my pleasure to be here. Thank you, Roei, for inviting me.
Thank you, dear panelists. And as all of you can see on the webinar, we have a true subject matter experts that will help us learn, discuss, and analyze the top concerns and challenges nowadays. But before we begin speaking about the survey results, let's all step back and remind ourselves where we stand today. Educators are currently under tremendous pressure, and there's plenty to discuss. We're finally back to in-person learning, but that brings its own challenges. Schools are facing staff shortages and early quitting. Health and safety remain top concerns when it comes to schools. It's not only COVID. To top all of that, we are now facing the perfect storm or a tridemic of RSV, flu, and COVID. Given this context, I would like to turn this over to our panelists to hear from each one of them on what they think has changed, what are the main changes we're seeing in our schools from February 2020, before the pandemic, to now November 2022. Joe, would you like to start sharing with us your thoughts on what has changed since February 2020?
Well, I think to start off with, we have to remind ourselves that even prior to the COVID epidemic, we were having issues with flu epidemics, closing classrooms, closing schools. There were mold and mildew issues. There were a number of things that were affecting our schools. I think what COVID did was bring to light the fact that there are a number of issues with indoor air quality that we took for granted and really didn't pay attention to what that was doing to absenteeism, what it was doing for the learning environment. And so from that perspective, I think in addition to, unfortunately, the severity of the illness that COVID brought with it, it also brought that, that understanding that there are a significant number of issues with our indoor air quality.
I'm going to hop in with my colleague there, Joe, and certainly echo everything that he has stated. Going into schools pre-COVID, we know that there was a lot of, unfortunately, deferred maintenance with a lot of our schools. And as Joe indicated, definitely the awareness is there now because of COVID. And it's important, I think, that as Joe and Leslie can attest to, is to be able to get data, to be able to share and know what it is that our air quality is registering within the schools so we can address the issues that are there. I think that's a very, very important factor in terms of returning persons back to school, staff, faculty, and students, and be able to address, all of the upper respiratory diseases and infections that we have as we see us getting back to our quote unquote normal workday. I don't know how normal is going to get back to, but we're trying to get back to normal. And I'm sure, Leslie, you can share a lot in that background as well.
Well, it is interesting what we're seeing as we transition from a time where our schools were completely shut down, where teachers were being, I won't say forced, but they certainly had to change the way they taught and how we taught our children. And now they're coming back into school with overcrowded classrooms, with teacher shortages. And so there's a huge concern for the environment that our schools are providing for our students and faculty. There's a huge concern for the safety of everyone involved as well. But I think probably what everyone needs to, as we go through this particular webinar today, is to remember that our children were in their homes, right? Our families were in our homes, and there was a time they weren't being exposed to anyone. And now they're exposed to everything and everyone, and their immune systems are not ready. And that's why we're seeing our hospitals all of a sudden getting full again from RSV. There's just, as Roei stated, a perfect storm happening across our nation today. So we need to be very, very aware of what that means for our schools, our children and families, and to also understand that there is funding available. If you don't understand how you can make your school safer, then have a conversation with one of these panelists, and they can help you find the appropriate funding that's necessary to get your school the requirements and the equipment that's needed. And I think that's what's really great about this particular day for all of you, is to understand what we can do all together to make our schools safer.
Thank you so much for the insightful background. I think it will lay the ground for what we're going to see next, which is the survey. ORR commissioned the survey to take the pulse of the education market about their sentiments toward indoor air quality, overall health, wellness, and staffing concerns. Survey participants were comprised of teachers, administrators, and school facility managers. The main takeaway from the survey showed that nearly 75% of educators are concerned about the air quality in their classrooms. That is 3 out of 4 educators. We also found that 87% of educators feel their schools have not done enough to improve air quality. Panelists, what are your thoughts on that?
Well, I'll jump in real quickly because unfortunately, I'm not surprised. You know, it's a, you know, my husband's a retired school teacher of 40 years. And so this, unfortunately, is not new statistics, unfortunately. And I think that as educators, and certainly with people who are representing our teachers, our unions that are out there, trying to make sure that their environment is safe. This is pretty alarming, actually. Not surprising, but pretty alarming. And I will go back to the fact that if we do not have some type of data coming out of an environment to be able to share, and I'm certain with Joe's background, he can attest to the fact, if you don't know what it is that you're trying to correct, if you don't know what the air quality is in your schools, it's very difficult to go to the principal, go to a superintendent, go to the board and say, we need, you know, air purifiers, or we need detection for what's needed in these schools without having that data. So I think that's very important, and I'm saddened to see that these numbers are so high.
And to that point exactly, what concerns me is that there's recognition, but there's also recognition that there's very little action. And so from that perspective, understanding what CDC studies have already told us about the issues with, with pathogen scatter, with the ability to contract this this triple-demic through poor air quality, through the particulate that's flowing through our HVAC systems. It is surprising and concerning that we haven't put more of an emphasis there, especially when we have in almost every school district in the nation funding specifically allocated to be able to address these particular issues.
I think that's probably, I just underscore what the other panelists have had to say. But my one big ask of all of you here on this webinar today is to take action and have those critical conversations with your superintendents, with your administrators at your schools. Take a time to walk through a school. You might be surprised at what you find. I've dealt with schools that have ductwork laying on the floor. I've dealt with schools, there's just all sorts of health concerns from just the total environment within the school. So just take the time to take the action and understand what is so important about this particular survey, because this is the individuals that are teaching our future. You know, that's one thing I always said whenever I was president of National PTA, and still say it today. Our children are the future of our nation, and our educators are teaching our children. So both go hand in hand. Take care of them and take the time to speak up for them.
And I'll also add one more issue, Joe and Leslie, to the air quality and what's being detected in schools. And we all know that a lot of schools across the country have a mold issue. We know that. We know that there are a lot of older buildings and, you know, a lot of moisture that's being captured and sitting in spaces and places that it shouldn't be. And so we have a significant mold issue there. And as you see on this slide, only 31% say they have real-time air monitoring. So that's certainly a concern.
And to further explain that, thanks, Deborah, for bringing that particular point up. But that 31% in most cases is monitoring comfort factors, temperature, humidity. We're not talking about, in most cases, particulate. We're certainly not capturing anything that talks about the amount of mold, meaning mold spores that are flowing through our HVAC systems. So while it's important to understand temperature and humidity, and hopefully carbon dioxide from the standpoint of what that does for learning productivity, there are many other factors that weigh into true real-time air monitoring.
And I think that the next question we asked drilled down even more on the wellness, safety, and health. And one example you can see over here that this is the third school year since the pandemic started, and yet 77% of the responders expressed some level of concern that their school will be disrupted by COVID-19 or influenza A. And nowadays we can see the RSV becoming a top priority all over the news. And I'm sure that if we would ask the teachers and staff about RSV, you will see even higher numbers because we have some level of trauma from the pandemic. We're all faced something which was unique in history for all of us, and it is a big trauma. And as we will see from the next slide is that 50% of responders say their students are suffering even more from allergies and asthma and at a greater risk of COVID transmission and other viruses as a result of poor indoor air quality in schools. 30% say that poor air quality conditions impact students' ability to focus. So I want to shift the discussion for a second from COVID to more general impact of poor indoor air quality on our children, if it's allergies, if it's the ability to just sit down patiently and to be able to learn in an optimal environment. Panelists, I would be glad to hear your thoughts on the environment for the students.
I think from that perspective,
sorry.
Go ahead, Leslie. I'm sorry. No, go ahead.
I'd like to begin with letting everyone know that there is, through our association, we have legislative resolutions, and I want to read to you why, and this was before COVID, that we've been working, trying to get the indoor air quality addressed within our schools. And it's because children may be especially susceptible to air pollution because the same concentration of pollutants will result in a higher body burden in children than adults, because children breathe a greater volume of air relative to their body weight. So it's definitely impacting our students today. That's why you're seeing our hospitals full. That's why you're seeing parents becoming very concerned and administrators concerned that once again, we're going to have a school shutdown. Joe?
And what's significant about this particular part of the discussion is that there are a number of issues with air quality that have absolutely nothing to do with the pathogen load that we're talking about when we talk about COVID and flu and RSV. Carbon dioxide, which is the result of just normal exhalation. But when you have overcrowded classrooms, you wind up with a greater concentration, which we know through studies affects focus. It affects the ability to solve complex equations and perform more complex analyses. The particulate that we're bringing in when we bring in makeup air from the outside, whether that's smoke from wildfires, which continue to plague us, whether that's pollen, whether that's VOCs from industrial operations that may be going on around our schools, or from the disinfectants that we're using currently in our own schools. All these things contribute. And from that standpoint, filtration is only one part of that solution. In a lot of cases, we think, well, we'll just up the capture capability of our filters and resolve this issue. Unfortunately, that only solves part of this problem.
Absolutely. My goodness, Joe, you laid it out so eloquently. And as Leslie articulated in terms of the air to body weight for our children, they are truly more susceptible now. And most of us have an allergy of some sort. Some of us have, asthma at different levels, and our children in particular, unable to focus in school, which of course is a direct correlation to their grades and their test scores. And that's why there's so many parents. And I applaud the parents who had to become teachers, who weren't teachers, right? Who had to become nurses who weren't nurses. There was so much that we had to address together as a nation over the last 2 years. And with the tutoring and everything that's gone on. So our students are suffering, and it truly does take a village. And so I hope that the information that we're sharing today with the panel and these discussions are going to be extremely helpful for all that's involved, our teachers, as well as our parents moving forward.
And just one more quick comment before we move off this particular slide. What we're talking about most of the time when we refer to this are our students, which absolutely is important. But when we take a teacher out of the classroom, learning changes. When we put a substitute teacher in, they may know what these students have been learning, they may not. And so there's also that effect of potential learning loss or not capturing learning where it left off.
And that's exactly what we're going to see next, is the unhealthy work environment. We can see that 47% of those surveyed say that poor air quality in their classrooms increases risk of illness, the greater transmission of COVID infections, and an increase in teacher sick days, which is exactly what Joey just mentioned. The fact that our staff, it's not only the student and children, but also the staff, which is working day and night to provide an optimal learning environment, is getting sick in the work environment, which is something that from my perspective is unacceptable. We can also see that 87% of responders said that overcrowded classrooms are a major concern. And 90% of the respondents say better indoor air quality will help improve their health and wellness. I would be glad to speak briefly about the teachers' angle and the staff, not only the teachers. And let's dig down and I want to hear your thoughts on the overcrowded conditions. Is it a major concern as expressed here?
It truly is. Even during COVID, this was a concern for every teacher union that we partnered with. Their biggest concern, they're a business. Education is everyone's business, and we need to really give an appropriate work environment for our teachers to be successful, as well as our children. So it's a domino effect. Whenever we don't provide that great environment, then you see, as Joe said previously, we bring in substitutes who sometimes are not prepared for the children that they are teaching. So I totally agree with this number. I don't think it's anything new, but I think it's great that we're pointing this out for everyone to see so they can actually go and help change the environment.
Well, and certainly Joe will certainly agree with this as well. As you, Leslie, not only our teachers, certainly, which impact specifically in the classrooms, but our school bus drivers. We across the nation were so short of school bus drivers who were out sick to be able to transport our kids to the schools. They couldn't even, in some cases, get to the schools where parents had to then carpool and do other types of innovative things to actually get the kids there. And then when they did get there, because of all of the teachers being out, they then had to, which in one school that I visited, there were sometimes upwards of 35 to 40 kids in a classroom where they had to bring in a teacher and an aide just because of the pupil-teacher ratio being so, if you will, out of whack. So this has been a serious concern, and I'm hoping that as we move through getting better indoor air quality in our classrooms for our students, that it will certainly help keep the rate down for the number of teachers who are out on a daily basis.
And up to this point, we've talked about certified staff, teachers, administrators, those people who are essential in the classroom. But I also want to mention the fact that this has also affected our custodial services, our maintenance personnel. Everyone who is in the environment is being affected by these issues. And so when you take out a number of custodial personnel who typically are responsible for providing the disinfection services as well as the cleaning services, then you've exacerbated the problem of the pollutants, the pathogens that are on surfaces in the air when you take out the maintenance people or a number of maintenance people. And this is also not just those school employees, but our contracted services individuals. We wind up with HVAC systems that are not operational, plumbing systems that don't get repaired. We've had a number of situations across the country where we have run out of tradespeople because of the COVID epidemic. And so from that perspective, we need to look at all of our support staff as well as our teachers and administrators and say that this is a problem that we have to deal with. We can no longer just be aware of this. We have to start taking action.
And I think there is a direct correlation between what we're seeing here and the fact that there's also staffing shortages, which is one of the main concerns we saw in the survey, but also I am hearing now, I'm at a K-12 facility forum in California, and staffing shortages is one of the main issues. And what we found was that 7 out of 10 educators say that their school faces a staffing shortage. Not surprised from the data here, but more surprised from the reasons. And what we saw is that health, safety, and COVID are highly represented in the responses. COVID and sickness is the reason for the shortage. In many cases, not only low salaries. And Leslie, I would be glad to hear your thoughts on this slide, which for me was surprising on the reasons. And please share with us what you think.
Well, again, I didn't find this too surprising. Teachers have been unhappy with their salaries for quite a while. What I did find that was a surprising statistic to me was their fear of getting COVID in today's environment with 3 years being out. And so again, we have to think about our teachers as a whole. And this one really points out their fear of the work environment that they're working in. And I will tell you, one surprising conversation that I had with a group of teachers was that they would never recommend anyone to be a teacher. I mean, it was just shocking to me that they're not willing to do that because they're not being supported throughout our nation on all of these particular levels of concern. So it's really important that we do address the air quality in our schools, that we give them the type of work environment that they require to be successful, and that we support them along the way. So this is really a great statistic for everyone to take into consider.
Believe it or not, Leslie, I thought, based on some of the conversations that I've had in schools, that the fear of getting COVID or the impact of long COVID, actually, those numbers may be even higher. What was surprising to me on this was the health and safety percentage, and indicating here that it was specifically noting poor indoor air environment. That's profound, because most teachers, early on, they were saying, open the window and get fresh air in. And as Joe mentioned, well, the air outside isn't always as fresh as you think it is, right, Joe? So, so to be able to see that, staffing shortages are included in the health and safety, and people are actually understanding the importance of that, it's a terrible number to be so high. But as we talked about earlier, the awareness is certainly been heightened. So,
well, and I think all those are certainly great points, but I think even in early retirements, we have to dig to the next level down and understand why teachers and administrators are retiring early. I think in some cases, and I've seen it firsthand, the anxiety of having to come back to this environment has created some early retirements. Long COVID, some of the other long-term effects of illnesses that they've experienced by being in this environment have caused early retirement. So I don't think it's as simple as saying just 40% of early retirements. I think we need to understand that in that number, there are also some of these other effects.
And I think before we'll hear a case study on Jackson Public Schools, there is one slide which is dear to my heart, which is the federal government budget. And I think what we're seeing nowadays is the fact that the federal government, the local government, together allocated billions of dollars, which are available for schools to reopen and invest in new technologies. I think that this slide shows the huge gap between what the government intended to do and the execution of schools. We can see that there is 64% which are not even aware to the fact that there are fundings out there to improve the main concerns that we just raised in the last 40 minutes. And for me, it was eye-opening to see the huge gap between the hard work and the budget and resources that are being allocated and the lack of awareness and kind of, I would say, the understanding of how to use those resources to the benefit of improving. Deborah, what do you think on this slide before we move to the case study?
I was just speaking with the school literally yesterday, and they shared with me that they, again, were unaware of the federal funding available. I walked them through the process, sent them to a site where they could actually go to get additional information and what it would take to obtain some of that funding. It's a disconnect. There's a disconnect. And I think, as Leslie mentioned earlier, for those of you who are engaged in this webinar, as we're speaking to you, please reach out to us. Allow us to steer you in the right direction. Allow us to guide you so that you can tap into these funds, because as Roei just mentioned, there are billions of dollars that has been allocated specifically to address the air quality in your schools. So reach out to us, allow us to be that bridge between this gap of communication, of knowing how to assess these funds. And I share this with you as Roei. It indicates there, one school system shared with me that they thought they were out of the woods. They thought that they didn't really need to address air quality. So I think that we need to make sure that we're getting the information out there, and we can certainly help anyone that's attending this webinar. Please feel free to reach out to us, and we would be glad to assist you and show you how you can obtain these federal dollars.
I think, Joe, that's a great ground for the Jackson Public School case study, and the fact that Jackson Public Schools managed to be proactive and to use various technologies, which one of them is our dear friend UVC CDE, which I would be glad to hear your thoughts, Joe, on what you've done, what was the plan, and share with the school districts that are nowadays thinking on how to improve, what to do, what's the first step. So if you can share with us your case study, it would be beneficial.
Sure. And thank you for the opportunity. Let me start by saying a little bit about the school system so you understand kind of the situation when we entered this exploration of how to improve indoor air quality. Jackson Public Schools is the second largest urban school district in Mississippi, with approximately 20,000 students, 50 school buildings, the average age of which is on the high side of 65 years. Now that's calendar age because of budget issues and deferred maintenance and some other things. Buildings are actually aging faster, components are aging faster than calendar age would indicate. And so a number of issues with HVAC systems, a number of issues in buildings, as Deborah and Leslie already brought up, with mold and some other agents that were already present. So the first question that when we saw this funding starting to be allocated, the first question that we as senior leadership asked was, what is it we want to solve? And just installing new HVAC systems, which was certainly allowed using COVID, is not the issue or not the total answer, just like adding filtration is not the total answer, because you have active live pathogens on surfaces moving through the air, and filtration at best, if you can get sufficient capture in your filters, is only capturing live pathogens. It's not destroying the systems. And so from that standpoint, I wanted to look at a really comprehensive solution. I will tell you that when COVID first hit, and I'm sure Jackson Public Schools was not unique in this, before I came on board, the solution was bleach. We're going to bleach everything, and that's going to solve our problem. Well, first off, as you know, I'm sure bleach is toxic. And so if you use improper dilutions, you're threatening the health of your custodial staff at the same time that you're trying to kill the pathogen. And the same thing, unfortunately, is true with many of the disinfectants, regardless of the application means. So even if you use an electrostatic sprayer, which allows the particles to actually cling to the surface, first off, you're not disinfecting air. Secondly, if you look at the EPA listing for what's effective in killing COVID and flu and MRSA and any number of things that you're trying to address, you will find those listed under pesticides. And they're listed there because the majority of disinfectants are toxic in their own right. And so their use, when they're sprayed, how they're sprayed, the protective equipment that custodial staff should be using when they're applying these, or maintenance staff, however you do that, is critical to maintaining their own health. So I can tell you off the bat, I am not a fan of disinfectant sprays or chemicals as solutions, and especially not for the long term, because once applied, as soon as that dries, as soon as it's past its wet contact time, the surface can be reinfected. So from that standpoint, again, I wanted a comprehensive solution. So I looked to technologies. I put out a request for proposal. We had 17 companies that responded. Of those 17, probably 60% were air purifiers, air filter companies. A couple more were a combination of air filters and disinfecting chemicals. The remainder were a number of different technologies. So it's understanding what technologies do for you, understanding what they can provide. And my bottom line to this whole explanation is be an educated consumer, understand what it is that you're getting. And if the people who are approaching you with those technology solutions are not willing to tell you not only the benefits, but the potential risks in applying those technologies, then you're with the wrong people. That was my first look at everything that was available. And the company that I chose was one that was willing to educate first and have those discussions before we ever talked about what kind of solution they could provide. And so, again, my bottom line is filtration by itself is not the answer. There are plenty of funds available, but there is a deadline on when to use those or when they can be used. So look to people who can provide you the education first, can help you with a comprehensive solution, and then look to the future to what can be done to prevent this from recurring.
Joe, thank you so much. I'm sure it was beneficial for those school districts which are now facing the challenge on what to do next. And I think it was a very important and insightful case study. So thank you for sharing it. I will be glad now to bring some key takeaways to share with the dear attendees and our panelists, and then we'll move to the Q&A session. So the top 5 takeaways is 1, leverage technologies. It doesn't have to be billions of dollars for changing or retrofitting or doing something which takes a lot of resources. If it's a budget and time, there are low or cost-effective solutions out there. Just be picky and choose the right solutions that fit your needs. Find the right partners. During COVID, we've seen a lot of different companies which were trying to use the pandemic as an opportunity. Look for those that have proven track record. If it's past performance, if it's history, ask questions, do due diligence. Don't think that anyone who is out there with the product or with the solution is the right fit. Another important thing which we're seeing is monitoring. Monitoring is a key part of a holistic solution. If you're monitoring, you know what should be the solution. It could be related to ventilation, it could be related to what filtration, it could be related to any significant issues that are in the environment. And while you monitor, you can find and address the right issues. Think beyond classrooms. What we're seeing is that a lot of schools are investing in classrooms, but then the students are going on the school bus, which doesn't have any ventilation or filtration and will become a huge petri dish. So think beyond the classroom, if it's cafeterias, elevators, hallways, bathrooms, those places which could be a huge risk. So look at it from a holistic perspective. And lastly, I would say before we move to the Q&A, funding is available. You just need to dig down, ask questions. As Deborah said, feel free to reach out, to ask us, to just search on Google. I can tell you, if you just search fundings, ESSER funding in your district, you will see a lot of information. 99.99% is public information that you just need to dig down and see. We'll move now to the Q&A session, and we received during the webinar few questions, which I would be glad to ask our dear panelists before we wrap up this webinar. So one question that just came is, how can I find and secure fundings? Who wants to take this question?
Well, the first thing I'll say is check with your State Department of Education. Funding was allocated from the federal government to the states, not directly to schools. And so they will know how much the state has allocated to each one of their school districts and how to secure that funding. In most cases, these are reimbursable funds, which means that the school district has to invest first and then request reimbursement. And so again, all those procedures will be known by your state comptroller or your state Department of Education.
And one other note to that I'd like to add, Joe, is in most states, as you drill down to the counties, municipalities, and the like, they actually have set up a department specifically for COVID. So you can actually, through your Department of Health, as well as Joe indicated through the Department of Education, they have set up an actual COVID department, and they should be able to also help you and direct you to where funding is.
Thank you. I see another question from the audience, and Leslie, I think that's a perfect question to ask you. Someone asked, if I see or I'm facing challenges with indoor air quality in my school, who should I address?
Well, what I would encourage you to do is talk to your administrator first. And if you are not getting any differences made, then you go up the chain of command, go to your superintendent. You know, and I would encourage you to get other parents and concerned community members to join you with your voice, because you have the power to make change. You just have to be willing to be tenacious, to let them know that you're concerned, to take pictures, to encourage them to visit your classrooms, to visit your schools. And again, go through the chain of command, talk to your school administrator. There may be something happening that you're not sure of, but then go to your superintendent. Again, if there's really huge concerns that are not being addressed within your schools or communities. And then the next step is always, I think, we just went through an election process, right? So we have legislators that we can reach out to and say, hey, we've got this problem. We know there's ESSA funding available. Help us make that change happen within our schools.
The other thing I'd like to bring up, and it's a plug for the EPA's Indoor Air Quality Toolkit for Schools. If you don't really know whether or not your schools are a contributor from the standpoint of poor indoor air quality, that toolkit is excellent. It provides checklists that you can use to determine whether or not there are contributors, whether that's COVID or particulate or pollen or high carbon dioxide, any of those kinds of things. It's a great resource, and it's very easy to use.
Due to lack of time, we'll share with the panelists only one last question, and then I would be glad to hear your final remarks. So the question which we got is, how do I know if the air quality in our school is below the acceptable level?
Well, there are many ways that you can know, and I think the panelists would agree, the way that you can really know is to have that air quality tested in some type of way, or through the monitoring, as Joe said. It's a little different when you're getting data on air quality as opposed to testing the temperature and the humidity. So make sure you have the proper tools. And so speak to your maintenance and facilities people. They can probably give you guidance on that. And certainly Joe can, in his background and expertise in that area, may even have some additional suggestions. But just be concerned about what it is that you're getting data on, whether or not it's temperature, humidity. you want to know whether or not there are pathogens and other things in the air.
Before we wrap up the webinar, we'll be glad to hear final thoughts from each one of you. What's the main takeaways and insights or recommendations you want to share with the great audience that we have here that took the time to listen? Leslie, you want to go first?
I think the key takeaway is that everyone recognizes that the indoor air quality is affecting our students, our staff within our schools. And, you know, one good way of knowing that is if there's one student missing and all of a sudden there's 2, 3, and 4 missing within a classroom, you've got a problem. And more than likely it's due to poor indoor air quality. And there are solutions and funding available for each and every one of you to address the issues within your school. So use your voice, be an advocate, and speak up for every child and teacher.
I'm certainly going to agree with Leslie on that in terms of absenteeism when you start seeing teachers out and students out. But what I just want to make sure that all who have joined us today, as Joe has indicated, there's so much information out there with EPA, with CDC, through your local governments, through your departments of health and whatnot. Reach out to your local legislators. That's what they're there for. Your US senators and congresspeople, your local government officials, your delegates and senators alike, you put them in office. This is part of what they're there to do. They're public servants and they need your help. You need their help in guiding you through this process. And by all means, please, please, please know, there is funding available. Reach out to someone, reach out to one of us, allow us to help you through that. And let's try to get our schools safe, as Joe and Leslie mentioned, for everyone, our maintenance people, our school bus drivers, everyone and anybody who goes into these schools, because they're bringing, and I just want to say this one point, Roei, which we didn't necessarily touch on much today, but it's impacting the kids in schools and they're bringing it home. So we have to really eradicate this situation because it's a revolving door. And so we're approaching the holidays where we'll be amongst families that still, there are some people for the first time going to be visiting their loved ones over the Thanksgiving and Christmas holidays. So keep all that in mind as we work together to try to make our schools safe for everyone involved.
The only thing I'll say, and thank you, Deborah and Leslie, for your comments, because I absolutely agree with that, is if after all of this, you still are reticent about where to go, who to get in contact with, any one of us is happy to help. We are passionate about this issue. We know there are solutions, and we are more than happy to guide you through that process.
Thank you so much, dear panelists. I would like, before we wrap up, to say thank you, and I truly appreciate you all sharing from your background, knowledge, insights, and educating the educators which are on this call. So thank you so much, Leslie, Deborah, and Joe, for taking the time to share insightful next steps and action items for everyone who attended this webinar. And I would also like to thank everyone who joined today's webinar. Thank you.